All right, welcome to the Break the Cycle podcast. We're going to be talking about Stellate Ganglion Block, SGB. It's a physical reset to the nervous system. We're here with John Howe, Dr. Howe, and we're going to do a full deep dive into this new innovative treatment. I'm super excited to learn more about this treatment.
Dr. John Howe is an integrative and functional medicine physician and the founder of the Howe Clinic, where he merges cutting-edge medical science with a holistic approach to health. With a background in both Western and Eastern medicine, Dr. Howe specializes in helping patients optimize their physical and mental well-being through individualized care. He has extensive experience in treating a wide range of conditions from chronic pain and mental health issues to metabolic and hormone imbalances. A passionate advocate for innovative treatments, Dr. Howe is particularly known for his experience in the use of Stellate Ganglion Block for treating PTSD, anxiety, and other mental health challenges. Beyond his practice, Dr. Howe is a sought-after speaker, educator, and thought leader in the fields of integrative medicine and mental health. He's on a mission to revolutionize what we think about health, longevity, bringing fresh perspectives to both conventional and unconventional treatments. Thanks for being here, Dr. Howe.
Yeah, my pleasure. Thanks for having me.
Howe.
Thank you.
Woo. We're also going to hit some topics like nicotine, peptides, and more. It's a lot of Danny's favorite tools, peptides and nicotine.
Yes,
All right, but before we dive in, we're going to do a little game, hard pills to swallow. So I have a pill bottle here. Shout out to you, our lovely intern who made it. And each little pill has a question. So I'm going to pass it over to you.
Okay.
To start off. Pull out a pill.
They're actually in here?
Yeah.
Oh, wow. See if I'm able to read it.
Yeah, there's some
You're gonna
small
have to-
pieces of paper.
Yeah, push it open.
There it goes.
Here.
Pops open like that. You want the pill back?
No. Do you need help grabbing it? Just
No,
like
I got
squeeze
it.
Oh, you got it. Okay, well.
Yeah. Oh, God. Jeez. Please.
It's wrapped so tight.
I know, we really did it. Okay, you want to read it out loud?
Yeah. If you could take a tablet to ensure you never fail again, but you lose your creativity, would you risk it?
You never fail again,
That's yours. What do you think?
but you lose your creativity.
That's a hard pill to swallow.
So my question is, how can you succeed without creativity? Does that make sense? Like,
I've been doing just fine.
Well, would you take the tablet? Read it one more time.
If you could take a tablet to ensure you never fail again but lose your creativity, would you risk it? No, because I feel like trial and error has always been like my
There you
thing.
go.
You know,
You can't learn unless you fail.
yeah, you have to, all my learning experience, and all of that comes from like brings my creativity too. It brings my personality. Everything that I've been through has definitely played like a pivotal role in like who I am.
Yeah,
100%.
that's amazing.
Yeah.
But to never fail again, though.
I mean,
Like, I wonder if like you get a lottery ticket. Like, is that a failure? You know?
I still wouldn't risk it
That's
because it's just
fascinating.
like more experiences can come when I do win, you know,
Yeah.
and I'll just take another loss, but it's okay because I know something else is coming. It's
Okay.
not all doom and gloom all the time.
Yeah. You're passing on the tablet.
I feel like you'd
Yes.
just be like a very wealthy vegetable, you know?
Yeah, which I would love, but absolutely love to be like, you know, like just lounged out on like a beautiful pink couch all day.
And
but
Yeah.
no capacity to ideate anything.
yeah, it would
Yeah.
just be. It would
But
be
just in a fat mansion in a Lamborghini.
With
Yeah.
some sparkly boots on.
just numb in the mind. Absolutely not. I wouldn't laugh. I don't think I would laugh.
Yeah. With any creativity.
Yeah.
Because like creativity is like your personality. Like, you
Exactly.
get like creative when you respond to things.
Yeah, you're thinking just everything about it. There's just no way.
Yeah.
Yeah.
I'd rather fail, live on the streets, and be.
Yeah.
And when we went to Burning Man during the speech, they were saying that like suffering is the predecessor to enlightenment. And I think that there's a lot of continuity
I agree
with
with
that.
that,
You know, it's
100%.
like you kind of need to experience the pain, like in order to really feel the pleasure.
Humans go a little crazy if you don't have adversity. You got to push
Yeah.
against something.
Yeah,
Yeah.
And I think the most creative people are a little bit kooky.
yeah.
For sure.
Yeah.
That's why I think they are kooky.
Yeah.
So I've got all those different thoughts coming in.
That's true.
Yeah,
Yeah. Some of the most creative people, like, definitely they suffer with mental health.
yeah.
A lot of them.
Uh-huh.
Just like you.
Yeah, I would say, I mean, just the suffering in it, of it itself is like the. Say it again. What were you saying?
Suffering is the predecessor to enlightenment.
Yeah. I mean, both of you know I've struggled with drug addiction.
Yeah.
So going through just like homelessness, you know what I mean? Just all the different things in between. And that has brought me to like, I fell on my face and then I ended up falling on my knees, to like actually like ask for help and, come through and be successful. And my life wouldn't be where I'm at today if I hadn't gone through all of that.
Yeah.
There's just no way.
There's also relatability, I feel like, with failure as well.
Yeah.
Where you're like, you could relate to people
Absolutely.
and struggle.
Yeah.
And like outside of creativity, there's just like a empathy as
Everybody's welcome on the struggle bus.
Yeah. Choo choo ka-choo.
Yeah.
It makes you human.
And I'm the bus driver, but
Sit on down. Back in the bus.
and you will get through it. We'll get to our destination.
Yeah.
We might lose a mirror along the way.
Yeah.
We might lose the mirror. We were driving
But-
to Burning Man and
yeah.
our mirror just popped off.
Really?
Yeah.
Awesome.
Our friend just ended up hitting a sign, but we made it.
So you think he hit a sign?
Yeah. We don't know, actually.
It could have been a deer.
It just popped off.
Yeah. It could have been a human. We were in the middle of the Nevada desert. No way. Well,
An alien.
I don't know. Yeah, exactly.
Oh, God. Are you guys close to Area 51 out there?
I have no idea.
That's a good question.
You guys should have looked that up.
I think that's New Mexico.
Okay.
Way down, it's down south, but
Is it?
You never know. Spaceships can go really fast.
Yeah,
Yeah.
I'm about to say.
There were a lot of UFO art cards.
There were a lot of UFO
Makes
parts
sense.
at Burning Man.
Makes sense.
Okay, I'm gonna go with my hard pill to swallow. Oh shit, this one.
I dare you to swallow it afterwards.
I think I'm alright with the plastic. No microplastics here. Okay. Okay, if you could only keep one coping mechanism for the rest of your life, which one would it be?
Oh, God.
I think I use a few different coping mechanisms.
For me, it'd be yoga, because I feel like yoga is a hybridization of the spiritual, the mental, and the physical coping mechanisms all
Okay,
in one.
that's good because it's a physical release as well.
Yeah, exactly.
I would say my mood meter,
Your little chart.
my little chart. Just like being able to like label my emotions would be like a really good coping mechanism. I don't know, is that a coping mechanism?
I think so,
Sure.
yeah.
Coping strategy?
Something you reach for if you're looking for.
Yeah,
Yeah.
just like
I reach for the vape, you reach for the mood meter.
Yeah.
I'm like, where am I feeling on my emotional meter?
I'm a Danny. Exercise, hands down. Like that.
Yeah, what are you?
Exercise.
Exercise.
What type of exercise?
Surf, mountain bike, workout, run, whatever.
Wow, all of them.
Yeah, well, not at the same time, but
Yeah,
you know.
triathlon. It's giving triathlon.
Yeah.
Ironman energy.
Yeah, defo.
Have you done the Ironman?
Not the Ironman.
I feel like
You-
you're the type
yeah,
of
you
try
get
to-
Ironman
Triathlon, man, that's a
vibes.
full-time job. I don't know.
Yeah, it is. It is.
I got
it
other
is.
stuff I got to do. Maybe later.
Yeah, and you're a dad too, right? So
A few things going on. Yeah.
Yeah, you got a lot of hats to wear.
What's that show that they do, Knockout? Where they do the crazy
American
courses?
Ninja No Warrior.
Yes. Oh, my God, I love that. Have you ever done that? Would you do
No.
that?
I would pull a muscle quicker than anything.
Yeah?
But yeah. No.
Oh, God, I
Because
love
like
watching
the
it.
one that like the obstacle course thing.
Yes,
yes,
Those- That's amazing. Those guys are amazing. But
Yeah.
yeah, that's not me.
A lot of them are stuntmen too, like in their day jobs.
Crazy.
Yeah.
Wow. What about you? What's your coping mechanism?
I'd love to say something cool, but I really don't have anything like too cool. Obviously not working out. And I would love working out to be like, my old one used to be dancing. I used to love to dance. Probably
okay.
because I was a theater kid, but I loved like getting a good sweat in and like a hardcore like dance, like
Okay.
sweating balls, like dancing, like intense dance.
Yeah, with your heart.
Ecstatic dance.
Like
Passion.
whole like choreography. Like it really was into it. But I had a knee injury. It was a whole big deal. But I would say probably either a hot, like a shower,
Okay, good answer.
because that just resets.
That is really, yeah.
That
like
is-
a sauna sesh even?
Yeah, I'm cold or hot. A shower has fixed so many issues for me. I swear, like having a panic attack, can't go to sleep.
Get in the shower.
Getting in the shower.
Just run some water over your
Kicking
head.
heroin, getting in the shower. You know what I mean? Like, it has helped so many things. And like, I know that sounds crazy, but water and I don't know if it's because I'm an Aquarius, like a water baby.
Yeah.
But I'm like, getting in the shower. Like, if I could get in a tub all the time,
Just wash it away.
it just, it
That's
will
a
just
good
down
one.
the
That's a
drain.
good answer. It's
You
a
know,
good
it's down
answer.
the
What
drain.
about
Leave
cold
Kyla.
plunge? Do you do that?
Have you ever plunged?
I have plunged,
Yeah.
and I've also done the ones where they throw the balls at you and you sit there.
Oh, the tank, the dunk tank.
You like at the fair?
Yes!
I don't think it's the same thing.
No, it is, because
I
it's
love the connection there.
That's actually such a good idea.
didn't
They
follow
should make
her at all.
dunk tanks that are
It's like
cold
I've never
plunge.
seen
They're
that.
Then there's
cold
actual
water. It's
stakes.
freezing cold
Oh,
water.
you're right.
It's literally freezing cold water.
Hilarious.
one
Have
you
you
throw
done
the
a cold
balls.
plunge? No, but a dunk tank.
Okay, so first of all, I've done a cold plunge.
That was
I've
amazing.
also done like ice baths, like getting in the full
Yeah.
ice bath.
Yeah.
But I've also done the dunk tank, which
Yeah.
is also cold water.
Very similar.
The trifecta.
yeah.
And
Big tub girl.
even in the shower, I'll like turn it to cold real fast, like get a shock and then turn it back. I know it's kind of like kinky, but
No, it's
it,
really
like,
in.
You know what I mean?
that's you do that.
It like
As well.
revitalizes me.
Like if we ever like go back to back in showers, it's like always freezing cold, and I'm like, what are you doing? And
Yeah.
you're like, you have to end it cold.
Yeah, I always have my
it's good for
showers
your
cold.
hair too.
Yeah.
It's really good
yeah,
for
it
your
is. Decreases inflammation.
Should have started early.
I have eyebrows. I mean, it's so funny.
Look at me now. You know what I mean?
That's amazing. It's all cold showers. That's
definitely.
great.
It's definitely
Yeah.
it's
I
all
had
the
no
cold
idea.
showers. I've been anywhere. I've been like in like the worst situations, like jail, county funded rehab, get in the shower,
Wow.
crying in the shower, like
Wash it
please
off.
let me get through this.
Yeah.
It's a moment with God, and then I step out, dry off, whole new person.
Good to go.
That's awesome.
Yeah.
All right, Danny, what's your hard pill?
My hard pill is hard to get out of the pill.
You gotta push it. Give it a little oomph at the white end. It's the best way to do it.
Gotta get some nails.
Push it on the white end.
There we go. Ooh, just popped right out. Okay. Let's see here. I think I got the same one as you somehow. If you could only keep one coping mechanism for the rest of your life, which one would it be?
Wow, what a coincidence.
You? What are you
Cut.
doing, man? I'm just kidding. Let's see. Drum roll. All right. So, if overthinking were an Olympic sport, what medal would you win?
Oh gosh.
I would win, I think, a silver.
Okay.
Yeah.
A silver.
Yeah.
I think you'd be the all-star.
You be the Usain Bolt.
I'm working on bringing it down with the silver with the yoga, which is my primary coping mechanism.
true.
Yeah.
Um,
100%.
I mean, yeah, that's a pretty one-directional question.
Yeah, it is. What about you?
If overthinking was a sport, I would say gold.
Okay.
Platinum. I don't even think that's a medal, but yeah,
Michael
rumination, that like goes hand in hand with addiction too.
okay,
So
yeah.
overthinking, obsessing on things, 100%. Yeah. I mean, I'll overthink till the end.
Yeah.
Somebody sends me a wrong message at work, I'm like, I'm getting fired.
Yeah.
That's immediately where it's going to.
Really?
And it's really like it's heavy to deal with a lot of overthinking.
tough.
Yeah.
Yeah.
It's a hard
I
thing
think
to
I
deal
go
with.
bronze, maybe gold and like team, and then individual bronze. Like in certain situations, I'll overthink, and then
Yeah.
other ones I'm very action oriented.
You've caught me overthinking all the time.
Yeah, you spiral.
Yeah, he sees me. I mean, he can see it in me. Like, we'll be on a Zoom call. The ends, the phone's ringing. It's Elijah. And I'm
Yeah.
like, hey, what's up? And he's like, what's going on? And I'm like, nothing. He's like, I saw it all over your face. And I guess it's just like it's just a thing.
I think
I've
it's
really
energy.
worked on it.
Yeah.
Yeah. I've tried really hard. It's been like
difficult,
years
though.
and years and years of like hard work
And
to
it's
get through it.
fascinating because it's one of the primary proponents of the activation of the fight or flight mechanism, right, in your amygdala.
Mm-hmm.
And that's, why we have Dr. Howe here today, is because people are overthinking like
Yeah.
crazy. Their amygdala is active like crazy. They're in fight or flight constantly. They're winning the platinum, winning the gold medal in the Olympics, and they need to be able to shut it off.
For me, it's situational. Like there's some things that I will overthink a lot, but there's parts of my life, like my job, for instance, I don't ever have problems making decisions when I'm working clinically. But if I'm, trying to figure out a relational situation with a family member or something like that, then it's, I don't know.
Such
that's
a doctor thing to say.
Is it?
Yeah.
There you go.
No, but I think it's like logic versus emotional.
Yes.
Like
Yeah.
my emotional brain is very like I don't overthink. It's like it's a feeling.
Interesting.
Versus like in certain situations where I'm like not maybe on my strongest footing, then I'll start to overthink.
Yeah.
And it's almost like maybe the overthinking gets triggered when you're not working.
Yeah. And I wonder if there's any association too with like the masculine versus the feminine too, because I'm in the same vein too, where more of like the emotional, relational things are what cause me to overthink, whereas like work is pretty straightforward.
Totally. All right, your hard pill to swallow, Dr. Howe.
You should call them hard pills to open.
Yeah.
Ooh, that's
No,
a good one.
sorry. If your mental health had a soundtrack, what song would be on repeat?
Ooh.
You guys jump in on this one first. I'm going to think for a second.
Staying Alive by the Beat.
Yeah, that's a good one.
Oh gosh.
Yeah, I don't know.
My mental health was a soundtrack. Is it a whole? I guess it's
Whole album?
No, one single song.
If your mental health had a soundtrack, what song would be on repeat?
Ooh. I've got some.
I tell you what's mostly on repeat is like songs to calm me down and make me be able to focus. But that's like actually on my Spotify, not necessarily.
Playing.
I think what this is, well, I don't know what it's saying, but is it like what's going on in my head?
Yeah.
I don't know.
I'd say some punk.
Yeah.
Okay, good answer.
Like your hat?
Blink-182
Yeah.
vibes?
It's a pretty punk hat.
No, like not
Pretty
like
punk.
pop punk, like
Deep
some
punk.
let's get in the pit.
Okay.
Let's rage.
Is there like a notable band like that you could reference?
Yeah, that's actually one of my favorite bands. I have a tattoo of it. It's
Oh, wow.
Fiddler, Fuck It Dog, Life's a Risk. And their whole, the lead singer, that he's in recovery from heroin too, and he's like, his music is like just it speaks volumes to me, and it's like the most simple stuff. It's like there's a song called 40 Ounce on repeat. You know what I mean? Like it's just like relatable to me, where other people would be like, this man's out of his fucking mind.
Yeah.
But to me, it like calms me, it soothes me, because I understand like complications with just like relationships and with people and interpersonal skills, and like dealing with all of that on top of what's going on inside of you can be a hard pill to swallow.
100%.
So it's like comforting because you feel it, you understand
I
it.
feel it and understand it, and just that rage, that music of like,
Yeah.
is kind of like what my brain is doing all the time.
And I think that's like one of the most beautiful things about music is that it helps you relate, which kind of brings it to the earlier question, about like being able to not fail. It's like if you are flawed, then you are able to actually relate better to other people, and music's a great vessel for that.
Yeah, for sure.
What about you, E?
I feel like it definitely has to be upbeat. I would say like a little bit of like rap I would put in there, and I was thinking something like by Kanye. Like I feel like I'll listen to him in the mornings. It's like a morning espresso for me. It like really just pumps me up. I'm like in between a few songs.
Which type of Kanye? Like old school Kanye?
Yeah, old school Kanye. I would say like
new
Good
age?
Life. Better than the life I live.
Uh-huh.
I try to always like look
That's a
at it
good
like
one.
positive, like
Stronger too.
Stronger's a good one as well.
Harder, better,
Faster.
faster, stronger.
Yeah.
I think Good Life, yeah, because I always try to find the silver lining. That's like my thing.
Yeah.
It's like, where's the silver lining at?
Yeah.
Even if it's like slightly delusional, but it works.
Yeah.
Yeah.
And you, Dr. Howe, your final answer is spa music or what?
Spa music.
Well, see, now I'm confused by the question. Like, is this what I would listen to make me feel the way I want to feel, or is it like, what is my brain doing in the background?
Take it either way.
Either way.
Yeah, I get it. It's probably not spa music. That's probably what I do when I'm, again, trying to focus.
Yeah.
But that's a small amount of the day, right? So something upbeat, like what you're talking about, something that's inspirational, get you moving.
Yeah.
100%.
Yeah.
You need it. Yeah, positive vibes is the vibe. PMA.
Yeah.
Positive mental attitude, for sure.
On the way to work today, like my car just started playing like old retro, like 70s and 80s like rock music.
Sick.
Just you know how Spotify sometimes will just start playing a random song, and I just left it on. I was like, okay, this is a vibe,
What are we talking, like Billy Joel? Elton
Yeah,
John,
just like some old like retro rock music, and I was like, okay,
Love it.
Yeah.
it's
I
good.
wonder what like the old timers, old rockers would think about like today, especially like with what we're doing with like our health, our wellness, peptide therapy.
Yeah, right.
I think they'd be into
Ozempic.
it.
I mean, Mick Jagger's on this shit for sure.
You think so?
Yeah, I mean, I saw him perform at SoFi a few weeks back, and he was rocking it like Joe Biden's like son, and he's the same age. You know,
That guy's pretty incredible. What he can do still.
yeah,
Mick
Yeah.
Jagger.
Crazy. Yeah.
What do you think he's on?
that's what I'm saying. He's probably
Life.
on peptides. What do you think, Dr. Al? If you get an 80-year-old man in the clinic and he's like, I want to be rocking it like Mick Jagger.
Well, he does a ton of yoga. Mick Jagger does.
Okay.
No
So
way.
mobility is massive. I mean, you
sure.
look at like Tom Brady, who's 47, still playing in the
Yeah.
NFL. The fact that he's able to do that, it's all about recovery. It's all about prehab, like getting
Prehab.
So
Never heard
it's
that.
like rehab, but physical, right?
Yeah.
Physical
Yeah.
therapy, working on mobility issues, recovering fully. So I mean, Mick Jagger, movement issues. The fact that he can get down on the ground and still do what he's doing, that's bonkers.
sick.
It's
Yeah.
crazy,
I mean,
man.
people that are my age can't do that. And he's, what is he, 80 something? I
Yeah.
don't know how old he is, but
If you had an 80-year-old walk into your clinic and he's like, I want to be rocking it like Mick Jagger, what are you giving him?
I would say, what have you been doing for the last 80 years? Because it all kind of adds
Let's say
up.
that he can like walk.
Drug
Yeah.
sex.
You know,
Yeah. All the worst shit.
I mean, we'll get into it, I'm sure, through
Yeah.
all the treatments and whatnot. But I'm curious, like, what can really bring in that vitality?
Sure.
You know?
I mean, I think the most powerful thing that we do for guys, women too, but is testosterone. Yeah, it's not for everybody, but it's a massive factor in everyone's lives. People, women think usually we think about women having primarily estrogen, and men primarily having testosterone, but we both have both.
Mm-hmm. Yes.
And when you look at the amount of testosterone a woman has, it's actually 10 times the amount of estrogen that she has. They're just reported in different units. So the numbers are going to be similar, right? But it's picograms per deciliter versus nanograms per deciliter. So it's 10 times. And testosterone gets turned into estrogen normally in the body. So anyway, the short answer is likely it's testosterone. Although there's a lot of things we can look at.
So Danny, next time you're feeling some type of, I'm going to be like, calm your estrogen.
Yeah. Yeah. I mean, I take Tonga Ali and Fiducia Rogizia or something like that. I need to be more consistent with it. But yeah, I'll notice in the gym especially, like my PR will go up 10, 15% if I'm consistent on it for like a week or two.
Yeah, HGH is another one. I don't do a lot of that, but that's a human growth hormone. That's has a lot of effect on people. I mean, the things that then there's a huge spectrum, right? The things that are kind of herbal and low risk, going all the way up to anabolic steroids and other things. And in the middle there, usually you find a place where a person and a provider are comfortable with what's happening from a risk study, like supported study standpoint, and then the potential benefits. And that's always kind of the balance that you try to find.
So when did you open up the How Clinic? Because you're basically, tell us more about, I guess, the clinic. When did you open it and what you actually do at the clinic? Because it's quite fascinating.
Yeah, so February 2020, which is the very beginning of the pandemic, which is a fantastic time to start a business. We opened our doors, and so that was the beginning. I started doing mental health at that point, and then focusing on regenerative medicine, which is using different types of substances that are injected into the body, primarily to try to restore tissues that are broken down, degraded, or release nerves or tissues that are pinched and not moving well. So that's kind of how we treat pain in a nutshell. I started noticing that the patients that I was treating for pain, I would have two very similar patients with what seemed to be very similar problems, and they would have drastically different outcomes. One would do much better than the other. And so then why does that happen, right? You want people to do well. And I started looking at the hormone, nutrition, vitamins side of things, because that often seemed to be one contributor to it. So I started going into that part of medicine and brought on some providers that are better than me at that to help me with that side of things. And I focus primarily on the regenerative medicine and the mental health. And then I have a naturopathic doctor and then a physician assistant who specialize in the functional medicine side of things. Functional medicine being trying to find the root cause of whatever the problem is, whether it be hormonal and nutritional deficiencies or lifestyle choices or whatever, and helping people to improve those factors to overall improve their lives.
Yeah.
That's amazing. So it sounds like a hybridization of multiple different lineages of medical practice, if you will, with regenerative, and then you have the naturopathic, the functional, all of it under one roof.
Yeah, I mean, I think it's what I find and what is true in a lot of different disciplines is when you have different ways of addressing the same problem or complementary things that help with a set of problems, that's when people are going to have the better outcome. If you have a hammer, everything looks like a nail, is the old adage, right? So we try to have multiple tools in our toolbox, different ways of approaching the way a person's feeling or not feeling and they want to, and trying to help them with that.
Wow.
I got to ask, what were you doing before you opened the clinic?
Oh, emergency medicine. So I'm an ER doc.
Okay.
For how long?
15 years.
Wow.
Yep.
So you make the transition from ER doctor to opening your own clinic.
Right. I didn't stop one and start the other. I was still working in the emergency department, and I still do some of that work as well.
Were you down in San Diego?
Yep.
And
where are the big eyes?
It's crazy because I was in San Diego and I was like, this must be the guy that gave me this. I was like, this must be the guy. This must be the guy that saved my life.
Okay,
it could be you, it may not be you, but I had like a suicide attempt, and I came into the ER and I was coming off of Xanax and fentanyl, and I was like at the edge of my seat, and this guy was like, I can give you ketamine, and I was like, okay. And he gave me ketamine, and I came out of it, and I didn't get 5150'd. I was like, okay, I'm ready to go. I had like a whole experience. Was able to walk up. I had just lost my grandfather and like packed up my stuff and like had a really bad breakup and just had that experience, got my stuff together. Of course, I still wasn't doing well afterwards, but he was like, that's what I could do to help you.
Yeah.
And I'd never met a doctor that would just be like, all right, this is what we're doing. You know, like he was like, they were pushing other remedies at the time, but I was like, this must be the guy. You know what I mean? Because I've always been wanted to be like, thank you. Because if I wouldn't have done that, who knows where I would have been. So I just wanted to ask. So it's mental. You were doing mental health, just like trauma in the ER, or like what were you doing?
No, I was doing standard ER.
Oh,
so
gosh.
you know, whatever comes in the
I'm
door.
sure that was crazy.
It's a great way to live for a while. It's a young man's game.
Yeah.
But, I don't know. Like I said, I still do some of that, and it's a different kind of medicine. It's sort of like putting the fire in the house out instead of, you know, doing finishing carpentry, if you will.
Yeah.
It's so funny.
You meet people that on the worst day of their lives every day,
Right.
and that can be rewarding. It can be extremely challenging, and that, you know, it'll wear on a person in a lot of different ways,
I'm sure.
and push me toward the mental health side of things because I started having my own issues. You know, you get really good at compartmentalizing for a decade and a half, and then your compartments start popping open and the demons start crawling out. So anyway, that was part of the journey that I went through. But anyway, back to your point. Yeah, using ketamine in the emergency department is not something that has traditionally been done. We do it for like broken arm. We'll sedate somebody, give them a whole bunch of ketamine or enough to make them so they're comfortable. But because the mental health crisis is so bad, and the emergency department is the receiving area for so many people in crisis,
Which is crazy to think that you break an arm and then you're also like have a suicide attempt and then you're rolling up to the ER. Like that's crazy. There's one place that's handling
they happen at the same time because you can break your arm as part of a suicide attempt. You know, that's the whole thing.
Good point.
But where I was going with this is ketamine can actually de-escalate people quite quickly and take them from suicidal to not suicidal. Because emergency medicine, the psychiatry or the psychiatric care that we do in the ER is not, like I said, we're putting out the fire.
Yeah.
You want to kill yourself? Let's try to stop you from trying to kill yourself and get you some sort of plan. And then we need to get you out of the emergency department because this is not the best place for somebody that's having an anxiety attack when all the stuff happens around them.
Right.
The ER is a little chaotic.
Yeah.
And you need a place where a person can zen out, not deal with this and just eat turkey sandwiches and sit there in a hospital gown, because that's not cool, and people don't de-escalate well with that. So ketamine has been a very interesting tool. Not all the emergency departments across the country are doing that, but we've started developing protocols that, much like what you were describing, we can de-escalate somebody.
Yeah, it was definitely helpful.
That's awesome.
So the question remains, do you remember administering ketamine to a woman?
I have administered ketamine to a lot of people.
Probably
is there a
was. Who knows?
possibility
Full
that was you?
circle.
Perhaps.
That's crazy.
Full circle.
And then you mentioned that you went from like a burning house, like the ER, to then carpentry. Would you consider like the Howe Clinic carpentry?
Yeah, I like finishing carpentry. Kind of like taking someone who has, in general, a pretty good life. They're not in crisis. They aren't having a heart attack. They didn't just break something. They didn't crash their motorcycle. And now we're like, okay, why are we talking? Why are you even coming to a doctor? What part of your life would you like to try to improve?
Yeah.
Inevitably, that conversation goes into all the places if you have time, right? Because everything's connected. Mental health is health, and health is mental health, and you know it all kind of circles back on itself. So to be able to flow between both sides of that is really cool.
100%.
Yeah, definitely.
And you mentioned that you had 15 years at the ER and that you were having to compartmentalize certain occurrences, which I'm sure you saw really traumatic stuff and then had those beautiful moments as well. But was the creation or the inception of your clinic a means of almost synthesizing that compartmentalization of that trauma for yourself and like building a vessel and a space where you could almost like learn through the creation of the clinic as well?
That would be a beautiful origin story, but no, it was more of I'm good with my hands. I'm good spatially. I like using the ultrasound, which is a tool that we use in the emergency department for all sorts of things.
Yeah.
And the regenerative medicine is using the ultrasound to guide injections. I started leaning into that passion and learning more about that, and that's the path that I went down.
Gotcha.
People that were teaching me to do regenerative medicine also did this stellate ganglion block thing, and I was like, that's crap, that doesn't work, that doesn't make any sense. A shot in your neck can make you feel better. And then I started having symptoms that I began recognizing as PTSD.
Gotcha.
So I was like, hey, let's try this thing. And so I laid down and I had it done.
You did it yourself?
Well, not on myself, but yeah, I've had it done a few times.
That's what I was kind of referring to.
Yeah.
Like, did you start the clinic because you had PTSD from the ER and you needed to like double down on the solution? Like,
Sort of.
in some regard?
Yeah, I mean, like I said, I wish that I could say that was
Definitively,
that's
100%.
That's a nice story. But really what happened is I followed a different path, and part of that path was that I found this. And I found that it worked for me rapidly, thankfully, and it doesn't work that quickly for everybody. But I was one of the people that had a good effect and had a really quick effect with it.
Yeah.
And I said, that is cool. That's the neatest thing I've ever had happen to me.
Wow.
I want to do that.
Yeah. And that's the reason why Elijah and I started this too, is because like our family members suffered with like severe mental health issues throughout adolescence, and we saw them try all the traditional methods, whether it was prescription drugs, pharmaceuticals. My mother was hospitalized at the ER multiple times due to suicide attempts, etc. And when I learned about these innovative treatments like ketamine or SGB, etc., I was like, let's double down on this and help be a proponent in the democratization of these treatments.
Get to the root of the problem.
Maybe you can kind of reframe the story, because it sounds like in some regard that's what happened for you as well, even if it was, you know, not 100%.
Sort of through the back door around the back.
Pain to passion.
Absolutely.
Pain to passion.
That was definitely part of it. The reason that I find value and continue to have a very strong why in what I do is that what I do, whether it's from a mental health standpoint or a pain management standpoint or whatever, it helps people very dramatically in all the time. Not all the time. Very frequently. It's extremely gratifying to do it. And it's not only that, but it's something I resonate with, because I can understand where, I mean, not everybody, I don't know everyone's story, but I can understand where people are coming from, because have been there and or still are. You know, this is life's tough.
Yeah, for sure. And you mentioned the SGB. Can you do a little bit more of a deep dive on that treatment for someone that knows nothing, a novice? Yeah,
happy to. So this is a procedure that's relatively simple, extremely safe, that effectively resets the emotional set point. So your fight, flight, or freeze system is responsible for the symptoms of anxiety, the symptoms of PTSD, some of the symptoms of depression. And when that's overactive, those conditions, the symptoms of those problems are made worse. And so with the injection, with the procedure, we're resetting that emotional set point.
Okay, so what does the procedure physically look like?
It is an ultrasound guided injection. So we use an ultrasound to look at all of the structures. It's here in the neck. It's next to the voice box, maybe about a finger breadth or two above the clavicle. And we put numbing medicine. So the same stuff we use, like when you go to the dentist and your tooth gets numbed up, it's not exactly the same, but it's the same idea. It's not any kind of medicine that puts you in a weird spot. It just basically turns off the nerves in your neck that connect, you mentioned the amygdala, which is the part of your brain that is your fight, flight, or freeze center, connects that to the sympathetic chain, which is the part in the body, and disconnects that communication for a brief period of time. And it changes how a person reacts to trauma.
Super fascinating.
So this is a nerve in your neck.
An injection.
Like a bundle of nerves, yeah.
Oh, wow. Because, I mean, the nervous system goes all through
all
the
the
body.
way through. And when I visited the clinic, you mentioned like your normal like nervous system would be like a 2-lane highway, and everything would be like copacetic.
Right.
And then when you're going through fight, flight, freeze, it's like 5 lanes, 405, just like a lot is happening. And then the SGB treatment brings it back down to that 2-lane highway where traffic is functional.
Yeah. So as you're exposed to trauma, then the number of lanes in this analogy get more. And so a fairly mild stimulus, whatever that happens to be, a trigger, if you will, creates this thing that happens in your body where your heart starts racing and you get sweaty palms and you get very anxious and irritable and start reacting in ways that you're not proud of afterward. And it's because there's just too much information going from the brain to the body, too many lanes. And the procedure will take that 5-6 lane highway and bring it back down to the 2-lane road that it was.
Yeah.
It still works.
Yeah.
You still can react when you have to. You still actually, you're more able to do that because you don't have as much baggage you don't even really realize you have before you have it done. And it makes it so people can be their authentic selves more regularly. You can act instead of react.
Yeah. Yeah, because when I was in the clinic, I had the fortunate experience of actually interviewing someone that just went through treatment, and they were someone who had a really tough trauma that they experienced, and they were like, I've been having physical reactions. Like I would pick up a toothbrush and brush my teeth, and for some reason, just out of nowhere, I would have like this huge reaction, you know? So it affects like so many people. And hearing that story, and she was like, after the first injection, I felt like much better, but then I came in for a second injection. So for this treatment, do people come in multiple times? Does it just happen once and then they're good? Like, what does that kind of treatment protocol look like?
It kind of depends on the person. So 80% of people get a good response by doing the right side. Now, there are obviously two sides to the neck, two sympathetic chains. We start on the right side because that's where the majority of people get the benefit. And 80%, like I said, of people get that benefit, and then we're done. And that can last for months to years. But it only treats what came before, right? And if something else happens, some repeated, another time, if you get sued, divorced, or whatever, come back and see me because it's going to happen again. Or there's some people that have high stress jobs where their life is tough and they know it, and they just know every 12 to 18 months I'm going to go get another one. If they get a good effect the first time, usually the first time is the biggest improvement.
Yeah.
Right. But if over the course of a year or so stuff has happened that puts you in a bad spot and you feel those things coming back, you feel those symptoms coming back, come on back and get another one.
Yeah. And to use the analogy of the highway, it's almost like the trigger is like a car accident, right? Like, and then SGB is, the ambulance and also the construction, bringing things back together and making sure that it's flowing. But yeah, I can only imagine people that, work at the ER or have a really high stress job. They're, having those micro car accidents on a daily basis, and they need to have that routine of like an annual or every 18 months going back and doing it. How often do you do it?
When I feel like I need it. I've had 4 now. Okay. Yeah.
Wow. I always think of it when like the way you're explaining it, and when Elijah first had told me about it, I was like, oh, it's like a cortisone shot. He was like, no, I mean, and that's how my brain is like picturing it, because I like to get rid of the pain, that's how I'm like, oh, cortisone shot. But in your neck, I thank God there's an ultrasound, but that's scary. I mean, for the love of God.
Yeah. Do you have a lot of people that come in and they're like, there's no way that I'm getting an injection into my neck?
I mean, as you might imagine, the people that come in for this are anxious people.
Yeah.
Or they are when they come see me. And I've done 900 plus of these things, so I've seen a lot of
900 people in the neck.
Yeah, well, done that many total injections, so sometimes those are both sides, right?
Yeah.
But yeah, a lot of people.
So a serial stabber.
Serial.
Yeah.
No.
How big is the needle?
Big enough. I mean, it's no. The width of the needle is very thin, but it's long enough to get to where it needs to go. The standard,
like an epidural?
No. The standard needle I use is about 2 inches long.
2 inches long.
Kind of depends on the person, because everyone's anatomy is different.
Yeah.
And so I'll look with the ultrasound and I can see how far it is from where I'm going to start to where I'm going to go.
Oh my God.
And if I think I need another one, like a larger needle, we'll use that. The thing that people mostly feel during the procedure, because like your question, like, is it scary? The thing people feel is the pressure, because I'm using an ultrasound. I have to push to see. Yeah. And the windpipe is right here. And this is a very intimate area.
Right.
So there is some discomfort, but most of it is pressure. It's not like, oh my God, this is terrible pain.
Yeah.
And out of like the 900, have you had anyone like kind of like not have an adverse reaction, but like going in, have like you were about to inject them and they like freaked out or something?
So there has been a couple cases when I was using sedation. So I would put the person to sleep before I did it. And that's not my preference to do that. And this is exactly why. When a person is kind of in twilight and you do something to them that is in a very intimate area that hurts, they're much more likely to react badly than if they're awake. And I can say, this is what's happening. Breathe through it. Focus on that type of thing. So when I have a person like I just described that's fully awake, maybe we give them something to take the edge off, but they're not out by any means. Then no. The times that it has been where people have moved or I felt uncomfortable and had to stop the procedure was when they were sedated.
Wow.
And they were just not all the way out.
Yeah.
Right?
I get that, because it's like control.
Yeah, people would think that like, oh, just sedate me and stab me in the neck, versus like when I was seeing the treatment, honestly, it was in and out and you're like, all right, all done. And I was like, what?
It takes 10 minutes or 8 minutes.
Yeah, but like even just you doing the ultrasound, injection, pull out, I mean, I felt like it was 45 seconds max.
The amount of time the needle's in the body actually is very small amount of time.
She's literally like, bloop, bloop. It's almost like a shot at like the doctors.
Interesting.
Yeah. So most of these 900 individuals that you've administered the treatment to, would you say are like veterans / emergency room doctors, ER professionals, or do you oftentimes find like executives or housewives in there as well? Like, what qualifies you for that treatment?
I mean, the groups that you mentioned, sure, those are definitely part of or a high number of people that I see, and there are subpopulations that have more PTSD or they bear a mental health burden more than perhaps others. But it doesn't have to be like a big, what we call capital T trauma, where something terrible happened and then I have these symptoms afterward. That sometimes happens. And that's like our warfighters or our first responders or people like that.
Right.
Or they have a bunch of those.
Yeah.
But having a bunch of lowercase t traumas as well give people the same set of symptoms.
Yeah.
And that can be, frontline healthcare workers is a great example. Seeing things that shouldn't happen to people.
Yeah.
In your mind, there's a concept of moral injury, which is a very interesting way of talking about being asked to do something or being in a situation where that clashes with your innate sense of right and wrong.
Yeah.
And being a participant in that is traumatic to a person's, and that applies to warfighters, but it also applies to a lot of other people. It could be caregivers, it could be people that nobody has a perfect family, but families can be challenging in a lot of different ways, right? So just to go through things that are routinely traumatic, even though that's your normal, that can put a person in this same spot.
Yeah, and it's fascinating. It makes me think about like what the definition of trauma is, right? Because it's so subjective. Like a knee scrape to a 12-year-old is a broken arm, to a 16-year-old is a bike accident for an 18-year-old, you know?
I was just going to say, like, your trauma, like, we can't even compare trauma.
It's relative.
Because you experiencing one thing, I would be like, oh, this is a piece of cake. You know what I mean?
Yeah.
And like somebody experiencing something else that I've gone through, and they're like,
as the bus driver.
Yeah, just God forbid. But you're right, little t, big T.
Yeah.
It doesn't matter. It's all a T, no matter how you shape it. But I can't imagine 900 people. Like, think about how many people this is it, and they get help. It's helping, and people are like getting relief from it. Did this just come out? Is this a newer thing?
The procedure's been around for 100 years, but used for other things. Yeah.
Wow.
In 2006, we discovered that it works for this.
Yeah.
And that the first paper was out in 2008. And since then, the research has, ticked up.
Wow.
I was actually,
go ahead.
I was doing some research on the inception of the SGB, and I found that like it was originated from hot flashes initially. Like they were studying how to reduce hot flashes, and then they found the application. Is that right?
Hot flashes, sympathetic mediated pain, so chronic pain in arms specifically. So you do the left side for the left arm. Raynaud's phenomenon, which is when like a couple of your fingers will turn white and be very cold, which is thought to be a dysfunction between the sympathetic and parasympathetic parts of the blood vessels leading to that area. Hot flashes for people that are going through, changes of life that can't tolerate hormones. The path to get here is really interesting. There are surgeries where they will go in and clip the sympathetic chain for different reasons. This also can be used for people whose heart is racing and not responding to medications like arrhythmia, so an abnormal or dangerous heartbeat. This has been used, or still is used, to treat that as well. So downright take the foot off the gas for the heart.
Physically reset it.
So in more like, I guess, new age medical terms, would you say that this treatment, simply put, facilitates mind-heart coherence in some regard?
I could follow you down that path. I think what the I think the
way
way
to stop them.
It makes it, because your mind and your heart is already connected, right? Your mind and your body is already connected
through the bundle of nerves, right?
All sorts of different ways, but yes, through the bundle of nerves. And that's why, incidentally, why we think the right side works for most people, because most people's heart's on the left, and so most of the nerves that have to do with heart function are on the left, and the other things are on the right. Anyway, that's an aside. But yeah, they're connected. It's a way to make them so that they work well together.
I got one last question on this. One last question. So with this injection, like, does this also help nerve pain? Like, because my two fingers go numb. I get like this sharp thing all the way down my neck, which is like from my bra strap and all that issues that I've got. Does that help that, or is it just?
It depends. So like normally the pain signals are carried by certain nerves in your body. Yeah. It sounds like you might have a pinched nerve up in the neck, but not the sympathetic nerves. The nerves that lead to your fingers come out of the neck. Yeah. If you have pain for a long time, the pain finds a new way to get to the brain.
Yeah.
And one of the ways that does that is through the sympathetic nerves. And that's why this procedure is used for chronic pain.
Gotcha.
Because we're trying to downregulate the sympathetic transmission, or the transmission of pain information through the sympathetic nerves.
Gotcha.
Yeah, so kind of a mixed answer there.
Super interesting. You mentioned the first papers came out around 2008 for mood disorder.
Yeah, so it was for someone that had PTSD.
For PTSD.
Yep.
It's interesting because I believe it's 2008 as well, ketamine for depression came out of Yale. And that was also like a huge step in the mental health space, or innovative mental health treatments. Like, we're seeing ketamine obviously have a rise. That's something that you'll do at the clinic, as well as the SGB. What are your thoughts on these kind of new innovative treatments kind of coming up? Because it seems like a lot of them, I think even in 2008, TMS was FDA approved as well. So it seems like this is a growing trend of like trying alternative routes outside of just traditional medication management. What are your thoughts on the progression of this?
I mean, it's an extremely exciting time to be doing this and be able to provide it as, to patients. The different molecules that are out there now that we're realizing they're getting more traction as far as legality, MDMA and psilocybin, along with the ones that we're already talking about. Those are not ready for prime time yet, but hopefully they will be. Much like I was talking about before, like when you have multiple modalities that can treat something and you can come at it from different angles, that's when you get the best outcomes. So the Stellate Ganglion Block is fantastic, but the people that do the best are the ones that have a mental health team. They're doing this stuff, or they've done it before. And then they do this on top of that. We merge ketamine and Stellate Ganglion Blocks. We have a study coming out in the next couple weeks to months that looks at those two together. Basically, it's better. If you got anxiety, depression, PTSD, and you put the two modalities together, you get an improved outcome as compared to a single modality.
Wow.
Makes sense. So,
instead of being on the traffic on the highway, you're flying the plane over all the traffic with both of them together, I'd imagine.
He loves that analogy.
Yeah, he loves that, that's right.
The analogy is that ketamine actually makes nerves grow, which is fascinating.
BDNF.
Yes, exactly. But it also binds to multiple different receptors that cause this, neuroplasticity and the window of healing. And so the analogy is with the SGB and ketamine is sort of a gardening analogy. The ketamine makes it grow well, and the SGB actually trims it, trims the nerves.
Wow.
And it does it in a way that ends up with a better outcome, which is fantastic.
Super interesting.
Life's a garden, dig it.
Yeah.
And it's actually true. Like, there are changes in the nerves. It's not just a hand waving analogy. We get more nerves that are better with ketamine. We get less nerves that are bad with SGB.
You put them together, you only got good nerves pumping.
Just nothing but good.
Yeah, that's really fascinating. Yeah, because it's like the toolbox is expanding, and that's like the dream with Cycle is like, okay, here are all your tools, educate yourself, and then it's like, all right, let's help you find a place that like best utilizes these tools, whether they're in combination or separate, and then like, is insurance covering it? What does that look like? Finances, so on and so forth. So like for
I think a point I would say, sorry to interrupt you, but it needs to be done safely as well.
For sure.
And there's a lot of people that I think patients often know what their problem is, or they have a good idea of what their problem is. It can go too far as finding your own answers to your problem. So there's a balance between finding people that know what, or think they know, patients that know what's going on, and finding providers that can provide the options.
Right.
But recent stories in the news have outlined or highlighted how people can get into real trouble by using these medications in ways that were not great. And there's been a public sentiment shift away from ketamine or against ketamine because of the Matthew Perry story.
Totally.
And it's, that's not the only story that's out there.
Yeah.
So I'm not a paternalistic, you must do what I say as a doctor when you come to my clinic. I am definitely somebody that works with people, and the people that I work with at Stella, that's what we're trying to do. Yeah. It's a blend of doing things safely in a way that keeps people safe, but also helps them. So.
Yeah. And I think to piggyback on that, you also mentioned the fact that you cannot just solely rely on the exogenous external administration of these treatments, but there has to be an internal relational support as well, right? So it's not like these are a silver bullet. You need to hybridize them in order to be a fully holistic, heart-centered being and be as developed as possible.
Beautiful.
Yeah. And is these SGB treatments covered by insurance?
They're not.
Okay.
They're not. Dun, dun, dun. Do you think they will be one day?
Yeah, we're trying. I mean, there was a bill through Congress that kind of got shot down, and this is for like the DOD and the VA to cover it. And there's a lot of hoops that have to get jumped through for that. Some patients get them for pain. Like I said, the traditional reasons to get a stellate ganglion block are covered. So you can get a stellate ganglion block done. The way that they're done for pain is a little different than what we do for mental health. And so are there patients that have been fortunate enough to get them covered by insurance for pain that get the benefit from a mental health standpoint? Yes. If anyone's done, if you know the setting, the intention, all the things that usually we talk about from a mental health standpoint, when we're in a therapy session, you're not going to get any of that in a pain management clinic.
Right.
Yeah.
Can you still have a good effect? Yes.
And that's everything.
Just like ketamine too. I mean, same
Pre
route.
and integration is
exactly
really important. So not covered by insurance. And how expensive are these treatments?
It depends on where you go, but they're around $1,500 per side.
So $1,500, 2 of them for $3,000, which for a lot of people that's like a lot of money, right? But then thinking about it, where it's like you're doing like DoorDash and like subscriptions and like all these other things where you're spending a lot of money, but it's like how much will this treatment affect your long-term life?
The value that people get from this when it works is immense.
Yeah.
There are people that routinely can get back to work doing the things that they love, or the relationships that they have with the people that they care about are improved significantly.
Yeah.
Right.
If you can become a functioning adult, whatever that means, when before you were really limited, it's likely the benefit is going to be there.
Right.
From a money standpoint. And there are foundations. There's a lot of different ways. Depends on what demographic you're in, but there are ways to get help with this.
And you can't put a price tag on a healthy mind.
Yeah, and to your point, if you boil it down to the actual numbers of it, like your earning potential goes up significantly when you have a clear mind. Like you actually just put it on a spreadsheet, you're going to be making more money.
And divorce is expensive.
Divorce
is
save
your marriage. Maybe that's
I mean, like lawyers are literally like 3 hours with a lawyer or an SGB injection.
Get over that betrayal and how that happened and be able to stay together. I don't know. Yeah, it's fascinating.
I mean, just even with just minute, like therapy is also expensive. Like people spend thousands and thousands of dollars of therapy in their lifetime and just getting this done quick. You know what I mean? Like that.
Doesn't take the place of therapy.
I'm just saying therapy is super helpful. In addition to,
Right.
Where instead of doing, just something that you make, you're making mountains instead of like molehills, so.
Totally. And I think traditionally, like you spending money on a therapist, like is more societally accepted, or it's just like understood. Like if I talk about my problems, like I can pay for that, versus like, let me save up for a few therapy sessions in combination too. And like, this could be way more effective in a way. And obviously there's not like one thing or the other, it's all in combination too. But I think sometimes you're in like, I feel like ketamine's the same way, where you're in this like waking state of consciousness, you're just in that same loop, and sometimes you just need a physical reset, and that this offers a physical reset.
Yeah, it's a positive inflection point in a lot of people's stories.
Yeah.
Yeah.
And sometimes you need that because you're just over and over again. So a majority of the treatments that you do at the Howe Clinic are SGB. Would you say that that's like the primary?
I guess if you break it down by days, I do SGBs 2 days a week, and then the other days I do other things. So no, it's not the primary thing that I do, but we do a lot of them.
You do a lot of them.
What else do you do?
The regenerative medicine stuff. The pain.
What is that? Like,
what is that?
Look like?
So if you have a torn tendon or ligament or arthritis, we can put different substances into the body. PRP is something that is, you take someone's blood and concentrate their platelets, and basically
like plasma?
Platelet-rich plasma is what PRP is. And what that does is it causes growth of blood vessels and tissues in areas that are irritated, inflamed, or arthritic. It helps to improve pain and decrease dysfunction.
Interesting.
And then there's also there's a technique that I use on pinched nerves in general in the body called hydrodissection. And we're putting fluid around structures, so nerves specifically, like your hand you're talking about.
Yeah.
There are two 3 cervical nerve roots that go down in this area that, like you say, can be through the shoulder or whatever, going into the areas where things are pinched and breaking up adhesions and creating space around structures. Normally your body should be able to, your nerves in your neck should be able to move and turn when you move and turn. If they're stuck and tethered and you move and turn, it pulls on them, and then you get pain or numbness in the hand. This is just an example. But creating space around that, breaking up adhesions and making so the structures can move more normally can improve pain pretty dramatically and fairly quickly.
Yeah. And that goes down in between your elbow, right? That nerve?
Different nerves, yeah. So you've got 5 nerves that come out of your neck that form the bundle of nerves under your collarbone, and that all goes down into your arm.
Yeah.
And they all kind of blend in.
Into my elbow.
Yep.
Wow. God, it hurts so bad all the time. I want to dig it out, pull it, whatever it is out. It hurts so bad. That's so interesting. Fluid. There was something else that I wanted to ask. What was he doing?
The peptides as well.
The peptides, and then
Is that what's going on with the penises?
Yeah, what's going on with the penises?
I want to hear all about the penises. That's what I want to get into.
So the thing I was just we were actually just talking about, the PRP, platelet-rich plasma. Again, what it does is it causes collagen growth and nerve growth and blood vessel formation.
And that's going into the penises.
Or clitorises.
Wait, so you're back up. You're injecting PRP into clitoris and penises.
Yep.
Why?
It's used for anorgasmic disorder for women that have lack of sensation.
Oh, wow.
Or it can also be used for urge incontinence. So especially after a woman gives birth, when they cough, they pee.
Oh,
really?
Yeah.
It's not great.
Yeah, it helps with older women too.
Yeah.
Yeah.
Because, as you age, tissues become less elastic.
Yeah.
So what you're doing is you're causing collagen formation. Collagen is one of the building blocks of the body, right? Collagen formation near the exit of the urine. So the urethra, where it comes out in the anterior vaginal wall, we'll put some PRP there, and it causes collagen to form there. So it's not as easy for the urine to come out. But then we also put it, this is for for women obviously, into the clitoris, because it will cause the clitoris to become more pronounced. Bigger.
Yeah.
And it has more blood vessels and more nerve endings in that area. And so you can have an improved sexual function.
Yeah. Wow.
And for men, same idea, but you put it into the penis.
Where at in the penis?
Let's say that you go here, and then into the head.
Wow.
Well, you're all over the penis.
5 injections.
Different ways of doing it, but that's one way.
And why in penises?
For erectile dysfunction.
Okay.
There is some data that you do to get some improved size as well. Okay. Usually it's girth, although it's best when it's done in combination with vacuum assist erection devices, penis pumps, basically. And you have to, there's a protocol that's done. And if that's the primary thing that you're trying to do, and it's not uncommon where guys want more size there. So we'll do the PRP injection. And then there's a protocol that a person will do on themselves for a period of time. They pump it up. So 10 minutes a day, twice a day.
Wow.
Whoa.
Yeah.
It's like an exercise.
Yeah.
And you have to
it's like lifting weights.
It's very much, they're stretching. There's a whole bunch of things that you can go. But most of the time we do that's for people that are using some, Viagra, Cialis, the medications that are used to help with erectile dysfunction. Oftentimes what we see is that the dose that a person needs to get an adequate, whatever that means to them, erection is less after you have these injections. Sensation's better. There's a bunch of different benefits that come from it.
Wow.
Fascinating.
And ultimately it's because it's increasing circulation and decreasing inflammation.
Not necessarily inflammation. It's causing new tissue to form, some more collagen deposition in the areas. And we're putting it the penis is kind of like a glorified water balloon, which is not untrue of the clitoris as well, meaning that inside the shaft, there are 2 what are called cavernosa. So call them water balloons, and they're connected. The reason you get an erection is because the blood flow in is more than the blood flow out. So the penis fills with blood, and that happens in because of a number of different reasons. Arousal is one thing, like mental arousal, blood flow to the area. It has to, if you have problems with your blood vessels, or if you have problems with the nerves that go to that area. For instance, somebody that has had prostate cancer and they've had their prostate removed, the nerves that go to the penis go right around the prostate. And so that can affect your ability to get an erection. Anyway, I'm getting a little off topic here, but the idea is that we're trying to increase the amount of blood flow into the penis and keep it in there during the time that we want it in there. And it has to get out eventually too.
Yeah.
Because too long of erection is a bad thing. You have to go to the ER for that. But
have you ever ran into that before? Someone just has like a permanent boner?
Not permanent, but yeah, that's a condition that we treat. I want to say routinely, but yeah, it's something you know how to, when you train for emergency medicine, you know how to do that.
Damn. Does that just mean they got too many PRP injections, or how does that happen?
Did they take a rhino pill?
Did they what?
Take a rhino pill?
One of those gas station pills?
Gas station boner pills? Yeah. Can be that. Can be methamphetamine. That's a really good reason to get it.
Oh, wow. Yeah, the good old meth.
Good old meth, not a health food. Yeah.
Really?
Yes.
Yeah.
I didn't know that.
They'll go all night. Meth heads will go all night. Damn. And not from personal experience, from stories.
I've heard some stories.
But then there's also people that have erectile dysfunction to the point where they will give themselves injections of medication into the penis to get an erection. It's called a Trimex injection. There's different, that is one of the options for people that cannot get an erection, specifically for people that have had prostate surgery where they don't have the nerves, and they basically do that. And if that doesn't wear off in time, then they have to come to the emergency department, and we do things to make it go down.
Wow, that is wild.
Yeah.
That is crazy.
Imagine someone coming in because they have a boner that won't go down, and then someone else coming in for a suicide attempt, and then someone coming in for a broken shoulder. It's like wild, the things that you must see.
You got to be the expert in the first 3 hours of everything, basically.
Yeah.
That is wild. That is absolutely crazy. So the How Clinic got it going on.
It's a great place.
It is a great place. Are there any?
So many penises.
Yeah.
Was that enough penis talk?
Yeah.
Okay.
Loved
But
it.
you said you want to hear all about that. So.
Yeah.
They give us the education.
Are there any new modalities that you're looking to add to the clinic? Like, is there anything kind of coming up, or anything you have your eye on that you're excited about for the future of mental health or physical health?
You know, for mental health, I'm really excited. I'm partnering with Stella. All of my mental health work now is with Stella.
Okay, so tell me about Stella. What is Stella?
So Stella is a international. Well, it's a group of providers that is a interventional psychiatry group.
Okay.
So we're doing interventions like the Stellate Ganglion Block, like ketamine infusion, TMS as well at certain sites, and it's going to come to more.
Transcranial magnetic stimulation.
Correct.
And Spravato as well?
Spravato as well, which is a type of ketamine.
Yeah.
Right.
Insurance-backed version.
Yep, absolutely. So
those are the big ones.
Those are the big ones.
Okay.
Exactly. And then there is integration therapy. So while you come into Stella's ecosystem and you're getting whatever the treatments are that seem appropriate, then also having people that can help you process what you've done, what you've been going through.
Huge point and piece of all this.
Needed.
It's so good. Yeah, and you need it. These treatments will change your brain quickly, and that can be quite dramatic. And so to have someone that knows what you're going through and knows the common things that happen and be able to talk to you about it and give you tools to handle that, positive or negative, right?
Right.
That is huge. So that's what Stella is, an interventional psychiatry practice. There's centers across the country. There's one in Australia, there's one in Israel, and there's going to be one in Canada. So spreading, into different countries. As an ER doc, that's my training, and I'm a proceduralist. I like doing things, but to have mental health experts working with me to do what they do well,
right,
augments what I do well,
right,
and it makes it so that we can have a product, if you will, or services that we offer where patients are well taken care of across. I'm good with my hands. Dr. Springer's great at talking to people. Dr. Boyle as well. I mean, there's Dr. Lipoff. There are people that have skill sets that are complementary, and it's a great place to work.
That's amazing.
Awesome.
So you work for the How Clinic. Obviously, that's your clinic, and then you also do work with Stella, and that's more focused on the mental health stuff.
Correct. Yep. Yeah. So I work in Irvine. I'm the medical director of the Irvine Stella Center.
Okay.
And then I'm also the medical director of the San Diego Stella Center, which happens to share a location with the How Clinic.
Wow.
Amazing.
And then,
amazing.
And then once a month I go up to Marin County currently to
Where's
do North Bay, San Francisco Bay Area.
Oh.
And we do some procedures up there, and we're looking to expand our offerings to other places.
That's amazing.
Yeah.
Yeah, because I know Stella does the SGB throughout the United States. They have multiple locations. And then the interventional stuff, so like ketamine, TMS, and then Spravato are only at a few locations, but SGB, they have like multiple locations throughout the US. Yeah,
and the vision is for the Stella owned sites to have, as all of the modalities that we were just talking about at some point in the future, and we're moving in that direction.
Yeah, super exciting stuff.
Many of our viewers have never even heard of any of these treatments, maybe ketamine. What would you say to someone who is dealing with PTSD, depression, or anxiety, maybe is just coming into this, like on this podcast, and, you know, is interested in exploring more, but maybe a bit trepidatious, a bit hesitant about taking a jump into a new treatment?
You know, I think the place usually people start is by looking on the internet and seeing, like, do my symptoms match up with whatever this thing is? And I don't know, you guys on Cycle, do you have like things where people can go on and take tests, symptom tests that gives them diagnoses? Is that part of what you're offering?
Not yet. We do more of like a PHQ-9, GAD-7, and then kind of from there, see where they are, and then be able to kind of educate them on the treatments. Yeah.
So, I mean, there are those tests that we just mentioned.
Yeah.
Those will give you
depression assessments, anxiety.
Correct. Anxiety, PTSD, and depression assessments. Those are the big three, right, of mental health usually. And then like see where you rank on those. And that can help guide your own knowledge of what you might be dealing with. And then you can match up by looking at, you know, talking to you guys at Cycle or going on stellatecenter.com and seeing what modalities might be helpful. And then once you talk, if you choose to proceed and get an intake with one of the people at Stellate Center, all those tests are done, which informs the conversation. These are the things that appear to be a challenge for you. You will have more symptoms of PTSD than depression, and maybe you would benefit more from the stellate ganglion block, but perhaps if you have access to having both, that would be the way to go. It's sort of a hypothetical way to go through it. But yeah, figure out what you're dealing with or not. If you're like, geez, I just feel terrible, then call up Cycle.
Yeah.
Or go on Stellate Center, like look around and see what's going on. And there are people out there to help you.
Yeah.
I just want to say the biggest thing that speaking to different people and patients that I've been doing this for a while, they don't know where to go. That's the number one thing. They're like, they get on the phone and they just want to talk because they're like, I have no idea who to call, who to talk to. I see my doctor every month, but he's like, you need to go see a specialist. And they're like, what kind of specialist? Like, and people don't know a lot of things. They're like, some lady was like, am I seeing a podiatrist? I was like, no, a psychiatrist. So you know what I mean? Like, people really have no idea what is available and out there. And I think it is a crisis right now. Like, mental health is a crisis that's been going on for quite some time. And people just don't have access. They don't know, which thank God for the internet. But at the same time, they're overwhelmed by how many treatment options that are presented to them. So they don't know what the best option is. And it's really difficult to navigate someone who's been on meds for a long time and they're like, it's not working. And so that's the main goal. I think we just want to be able to educate. And thank you for giving me all this information, because now somebody calls me up and they're like, how do I get penis injections?
You're like, you're on the wrong.
Screw that
you're on the wrong number.
Doctor, how? You know what I mean?
Can make you feel.
Because God knows what if their situation down below is causing them depression.
Yeah, exactly.
You know?
Or anxiety.
It's all related. It's all connected.
It's all connected. It's a holistic system.
Number one issue I always run into is people are like, what is this for? And I'm like, mental health treatment? Like, oh, I thought this was the eye doctor. People are just they just don't know. And education is a huge tool. 100%.
So hopefully we can be a helping hand. You know, that's the whole reason why we started this. And I think having guests like yourself will definitely help push that and help us serve our mission. So thanks so much for jumping on today.
That's my pleasure.
I love doctors. You guys always are a great service. I love what you guys do.
Yeah, thanks for what you're doing too. Changing lives, man.
Well, you too, because like you said, there's a disconnect between what people are feeling and what the treatments are, and I think that's the space you guys are filling, which is fantastic.
Yeah, we'll connect him. You're gonna heal him.
Yeah.
Deal.
For anyone who wants to learn more about the How Clinic or your work, do you have any resources, social media that you would point them to?
Yeah, thehowclinic.com, and How has no E on it, so HOW, and then stellatecenter.com for the mental health side of things. I'm on social media. I'm on TikTok and Instagram.
What's your handle?
JohnHowMD.com or the How Clinic. I'm sorry, JohnHowMD is my Instagram, and I forget my TikTok. We can put it in the show notes. But
yeah. For sure.
Amazing. Well, Dr. How, thank you for teaching us how to live a healthier life today.
Thanks for having me.
Thank you for the education too.
Pleasure.
Appreciate it.
Thank you.